During the past week, we have seen an unsettling climb in new COVID-19 cases throughout Pennsylvania. During the past week, that has especially been bad. When we hit our peak on April 9th, we had nearly 2,000 new cases that day, with other cases hovering around 1,000. That was our peak, 2,000. Medical experts looking at our current trajectory are projecting that a new surge is in the offing. And what we're seeing right now could soon be even worse than what we saw before. We had 994 cases just yesterday in Pennsylvania. So before, we succeeded at flattening the curve back in the spring. And we did that by working together, all of us. And we actually broke transmission links. So we got down to the point where we were actually in the 300 to 400 new cases per day. And Pennsylvania, as I recall, was one of the continues to be, but still was one of the best states in the country when it came to dealing with the COVID virus. We didn't know as much about the virus then as we do now, so we had to take a broad approach, sort of a blunt instrument approach to eliminating points of contact. But with our current rapid increases, we need to act again, but this time we have more knowledge and we can act in a more focused manner because we have a better sense of how this virus is affecting Pennsylvanians. Through contact tracing, we've identified 3 catalysts for our case increases. This is where we think the case increases are coming from. First, some Pennsylvanians have been ignoring the mask-wearing requirements and social distancing when they're visiting Pennsylvania bars and restaurants. They are unknowingly spreading or unknowingly picking up the virus. And this carelessness has resulted in pockets of super spreading. Second is out-of-state travel, both by Pennsylvanians who are returning from places they visited out of state and by out-of-state folks coming to Pennsylvania to visit us here. And the third catalyst for this new upsurge is a lack of national coordination. And that has resulted in states in the South and Southwest especially not committing to the things they should have done to keep this virus from spreading. Unfortunately, this virus does not respect state boundaries. And so we are paying the price in different ways for what states and other places have not done. We see that, for example, in testing. Sometimes takes as many as 10 days to get test results back. And that's not because of anything we've done. It's because national test places are being overwhelmed by the cases that they've seen in these other states. We're paying the price. We did everything we should have done. We were responsible, and yet we're paying a price right now. So the result is that other states have become petri dishes for COVID-19 during the time when we were all working hard here in Pennsylvania to suppress the spread. Some of these states actually now have hospitals at maximum capacity due to the COVID-19. And this virus knows no boundaries, no borders, as I said, so it's been spreading northward and eastward across the country and has reached our Commonwealth once again, this time from the west, the south, and the southwest. Together, these 3 catalysts have turned our downward trend into an alarming escalation. And we're already at a tipping point where we really have to act. We don't want to become Florida. We don't want to become Texas. We don't want to become Arizona. We have got to act now. So today I'm going to be signing an executive order that will implement the following mitigation efforts across Pennsylvania. First, restaurants will reduce their indoor capacity to 25%. The current outdoor dining rules remain in effect just as they are. Second, on-premises alcohol consumption will be limited to service with meals only. Cocktails to go and carry-out beverages are allowed. Third, telework must be implemented whenever possible. And fourth, indoor gatherings will be limited to 25 people, and outdoor gatherings remain at a maximum of 250 people. As I've said, we are using the information we have gathered over the past few months to create these mitigation efforts based on how the virus spreads, how it's spreading in actuality right now in Pennsylvania. We know that the virus appears to be primarily airborne, so we're placing more limits on indoor activities. We know that the virus spreads rapidly in crowds, So we're limiting crowd sizes in situations where people are likely to gather close together, such as bars. This is the virus speaking. The virus is making the rules here. We're just trying to anticipate what those rules are and doing what we can to reduce the risk that virus is going to do a lot of damage in Pennsylvania. Now, these new mitigation efforts are in addition to existing actions. They don't take away the importance of our personal responsibility to do our part, each of us, 13 million Pennsylvanians, to reduce the possibility that we are spreading COVID-19. That includes wearing a mask when we're out in public. It includes washing our hands, using hand sanitizer frequently. It includes social distancing as much as possible. We have seen these efforts work during the first wave in the spring. They worked, and they're going to work again if we all do our part. So I want to say thanks to every Pennsylvanian for your continued patience and your support. I know all of us, I am and you are, eager to get back to life as normal. That's the way it goes. But this is what we have to do. It may feel like a step backwards, but it isn't. It's just a reminder that we need to get back on the course of mask wearing, social distancing, and successfully mitigating COVID-19. Pennsylvanians should consider that even with indoor dining limited and bars closed for on-premises alcohol consumption, cocktails to go are still permitted, and there is no shortage of outdoor dining options. Small gatherings of friends in the backyard or at a local park, they're still permitted. And children and families are encouraged to responsibly take advantage of one or more of the 121 Pennsylvania state parks or other outdoor local and local fitness options. Children can visit local playgrounds, community pools. They can enjoy outdoor activities with their families. Gyms and fitness centers can remain open and are encouraged to offer more outdoor fitness options. I want people to spend time together, but I want them to do so while they're practicing social distancing, while they're wearing masks when required. When you leave your home and you're not participating in an outdoor fitness exercise, wear a mask. Every minute that passes is 1 minute closer to the end of this pandemic. That's what we're trying to achieve. And many researchers and many medical professionals are working diligently to find more treatments, maybe a vaccine, maybe a cure for COVID-19. So thank you, Pennsylvania, for everything that you've done, every sacrifice you've made. Let's keep working together. Let's keep working together as I know we can to protect ourselves, our families, our friends, our businesses, and our communities from a further spread of COVID-19.